Okay, hello everyone, and welcome to a new session of Clinical Pharmacology I. Today we are going to speak about the course syllabus review. I am Dr. Khalid Hassan, Professor of Clinical Pharmacology and Clinical Research. In this course, we are going to cover the pharmacokinetic, pharmacodynamic, pharmacogenomic, the foundation of every drug decision. Then we are going to speak about the autonomic nervous system. So the first one, kinetic, dynamic, pharmacogenomic. The second one will be autonomic nervous system, pharmacology. Then we have dermatology, HEANT, ophthalmology, otolaryngology, pharmacotherapy, immunopharmacotherapy or immunopharmacology. Then we have musculoskeletal pharmacology. The first section, or first unit, pharmacokinetic, pharmacodynamic. As you can see here, we have pharmacokinetic and then we have pharmacodynamic. In the pharmacokinetic, we are going to speak about absorption, distribution, biotransformation, excretion, route of administration, first order kinetic, zero order kinetic, volume of distribution, dosage modification, and renal dysfunction or hepatic dysfunction. Pharmacodynamic, the most important issue, we are going to speak about agonist, antagonist. We are going to speak about efficacy and potency. Also, we are going to focus on the concept of the receptor. So we have reversible receptor, irreversible receptor. Also, we are going to explain the concept of therapeutic window. Regarding pharmacogenomic, here we talk about drug metabolism and transport protein that shape the bioavailability and elimination. We are going to speak about genetic variation and that determine the dose and adverse effect, risk of adverse effect. Then we are going to speak about the drug receptor interaction, mechanism of action of regulation, receptor regulation, about up and down regulation. Also, we are going to discuss the policy and regulation of control substance prescribing. Autonomic nervous system, we are going to speak about mediators such as epinephrine, acetylcholine synthesis, storage, release, termination. We're going to speak about the effect of these mediator on the organ system. Speak about what is or are the major receptor type of our autonomic nervous system. We speak about cholinergic or um, acetylcholine receptor, direct acting cholinergic, indirect acting cholinergic, clinical use of these agents. Then we move to the antimuscarinic, and the prototype will be atropine, indication of this medication, and then we have depolarizing, non-depolarizing factors. Then we conclude that with the adverse drug reaction. Moving to the adrenergic system, we are going to speak about selective medication, non-selective medication, tissue distribution of these receptor alpha and beta receptor. Organ system effect also is very important. Clinical use and application, contraindication, adverse drug reaction. Dermatologic pharmacotherapy. We are going to speak about three main popular disease in the practice: acne vulgaris, psoriasis, and we have atopic dermatitis. So atopic dermatitis, acne vulgaris, and psoriasis, three main topic in clinical pharmacology. Glaucoma, ophthalmologic pharmacotherapy, and we speak about medication used for this, such as beta blocker, beta 2 agonist, prostaglandin, carbonic anhydrase, and other medication. Moving to the allergic rhinitis and common condition in the ENT, allergic rhinitis, otitis media, sinusitis, laryngitis, and all these on the table for discussion. Speaking about the antihistamine and other like topical and oral antihistamine, EpiPen as the another name, epinephrine. It's like life-saving medication for someone suffer from severe allergic reaction. Immune system is very important topic to cover in the clinical pharmacology one. We are going to speak about cell-mediated immune system, humoral immune system, medication used to suppress immune system, how this medication work. Then we are going to speak about antibodies and some cytokines in the clinical practice. Uh, NSAID, iconosonide. We are going to speak about prostaglandin, different type of prostaglandin, leukotriene also here will be covered. This will also lead us to discuss prostaglandin, thromboxane A2. Speaking about non-steroidal anti-inflammatory drugs, as you can see here, we are going to speak about mechanism of action, pharmacological effect, adverse effect, Rey syndrome related to the aspirin, and some other toxicity related to the cyclooxygenase 2. And then we move to the glucocorticoids, speaking about major natural corticoids in our body, synthesis compared with the hormone synthetic glucocorticoid comparing with the natural hormone, clinical use of corticosteroids, and to speak about the medication interfere with the cortisone action. Osteoporosis and gout. We're going to speak about the first line therapy for osteoporosis, what and explain the non-pharmacological management of osteoporosis, gout. We talk about prevalence, anti-inflammatory treatment, first line treatment for gout, focusing on the acute gout attack or like chronic attack or chronic disease. We talk about the non-pharmacological approach, also another important therapy. We conclude our course with the rheumatoid arthritis, osteoarthritis, rheumatoid arthritis, autoimmune disease, cytokine mediated inflammation. What type of medication we can use? On the table we have NSAID, we have cortisone, methotrexate, then we have DMARD for the rheumatoid arthritis. Speaking about osteoarthritis, degenerative disease, we talk about NSAID, COX-2 inhibitor, first line and second line therapy for patients from hip arthritis or knee arthritis or hand arthritis. Okay, this will conclude our course. As you can see from the beginning here, we covered the most important maybe part of clinical pharmacology one, pharmacokinetic, dynamic, genomic, autonomic nervous system, dermatology, uh, glaucoma, otitis media, allergic rhinitis, immunopharmacology, musculoskeletal pharmacology. Thank you for your time and have a great day.